So we've just heard a lot of takeaways from everyone. I think it was a very stimulating day. I always appreciate it when we do bring in people from other sectors. That really sorts of, changes our frame and stops us from just having this internal discussion. And it was challenging. We knew it would be sort of challenging, right? In terms of understanding exactly how they did things. And I think this question of, is there anything that we learned that's transferable to what we do, it's very difficult. And I sort of agreed with, I think you said this, Bobby, from your group, that since population health is very broad and incorporates many different factors and determinants, it makes it a little harder to think about how you're going to finance that overall community health improvement than if you had affordable energy, or if you had, juvenile reform, or, although but both of those were quite complex as well. So it's just hard to know. I want to again thank the planning committee. This was definitely a case of collaborative leadership, me leading from behind, but I think it was a very stimulating day from my point of view. So I hope you all found it that way too. I don't know why we had a smaller attendance. We had great attendance from the roundtable members, probably greater than many, but I'm not sure why this didn't attract a larger outside audience.
Thank you, Sunny.
Well, I think one of the things that we like to do at this time is also to give a chance for roundtable members to reflect on what's been said, particularly because the summary, if there's something that hasn't been said that you want to highlight or reiterate, or some new insight that you've had, this is a way to make certain that this gets on the record, so to speak. So I want to give a chance for any of the roundtable members or people in the audience here to go to the microphone and make some comments on your reflections of the day and what it's meant to you. I know we've done a lot in this afternoon session, there's some of that, but I'd like to give a chance for roundtable members to be able to do that in the closing here.
So this is a lot harder than than I would have thought, which is because there's a lot of nuance and texture to what's going on in these other sectors, and I don't know that you can, at least I can really engage it until I get to that nuance, or at least comprehend it. And so it suggests to me that there's an opportunity for deeper design processes to take advantage of expertise from adjacent sectors, if you will, to get to new insights. I think there may be potential there. I don't know. That's a testable statement. The second thing is I was thinking about these different sectors in terms of what we're aiming for. What's the overall aim? What's the overall objective? And I think there's some rationale for thinking about it in terms of my little interchange with you folks about is it energy in all policies and so on. But is there some framing around a broader framing than just health, but say well-being in some economic and educational sense that could be agreed upon across these sectors, and to which what we would call it health partners pathways, are sort of tangible pathways to that larger objective are drawn to the different sectors. So again, I think of that several reports from other organizations outside of healthcare that look at well-being that tend to capture human potential in terms of economic development and education, with health as only one variable as opposed to the endpoint. And would that help facilitate the dialogue? So that's a thought that I've had too.
Jose Montero, Cheshire Medical Center, Dartmouth Hitchcock. George went first and talked about well-being, and that's one of the key things that I wanted to highlight. That was a key learning for me through the day and an important reflection. by discussing with several other of the members of the attendees here today, we look at things such as that the system in theory is not designed for interdependence. And by that, what I mean is that each one of us tries to keep its own line. And that's the way that we invest, that's the way that we count, and that's the way that we expect others to behave. Stay in your line, in your lane, I'll do mine. And then some days we go and ask, why aren't you doing X? And part of our discussion here at the table is, so why these people in LA didn't realize that they were going to get such a huge impact on health? But then if we are critical of our own system, are we thinking of the impact of what we do when we intervene in children's health? What the impact on education outcomes is? And can we show that and find that common ground that will actually make us interactive? The definition of our society around health and the perception around health is a medical perception. And if we keep insisting in health in all policies, what we are talking about is hospitals in all places. And at least that's the perception of a key group of constituents out there. So we need to refine our language to be able to reach different audiences. Because when we are here, in between us, we know what we are talking about. But if we are unable to reach those constituents out there, we are not having the impact that we need, and we will not really help improve the outcomes in the health of the population, which is what this is about. And from listening to the examples today, what the economic presentations through the justice reinvention, and how valuable and critical that is, and how incredibly valuable an effort of taking even the concept of prevention as they are doing it right now at the individual level. And I bet that if we give them some time, they will get to the population prevention because the judge actually mentioned it. So they are getting there. Are we ready for them? And how can we be ready for them as a health sector? And how can we open our table and our door to help this cross-pollination, if you can use a cliche, in the sectors and the work that seems so aligned? So it has been an incredible day. I learned a lot. I learned a lot about new measures that I didn't know. It's good that we have here our energy expert at the table, because I had questions that were too embarrassing to make in public because I didn't know how many terawatts we use as a world. That was incredibly important, but that talks about the limitations of our language and our understanding when we go and talk and ask everybody to talk about health and all policies, when we don't even know how they measure what they do. And that is our learning.
So again, I want to come back to the role that evidence seems to play in making some of the arguments that we heard today, and just to think about what we can do as a roundtable to push forward on that. I think some of the things we've heard are that they're very, very rich data sets that we have no idea what's in them, that come from other sectors, and maybe we need to sort of think about fertilizing linked data sets that link back, or ask for surveys that help us track what's happened from what people have learned in education, and find out if we can find those people longer into their lives. We need to, I think, be more ingenious as to where we look for information. The other, I think, take-home for me is that, and we've sort of said this in many different ways, is to the extent that we're not talking simply about public health interventions, and we are, that's clearly a very important piece, but if we're talking broader, then, maybe part of what we need to be doing is to simply try and get invited to other sectors to say, what can we do to be helpful to you in accomplishing your agenda? So maybe we need to be much more outreaching in our participation in other thinking organizations, so that we can offer something and not make health be the center of the universe.
Thank you. Sort of building on this vibe, I think Pamela is the one that talked about the supremacy of health. I'm not sure where that came from. We've heard that before, and sometimes we follow, sometimes we're in coalition, and I think that to me that really was driven home in an important way. I think, and then Jose asked the question, are we ready for them? I think maybe that could be a responsibility. Is we can help people understand what they need to do to be ready, in framing their roles in coalition, whether it's in the justice system or working with, and supporting the work of energy. I think that Holmes Hummel said, if people have to spend that money to keep the lights on, beginning to phrase that in a different way for people to understand and make it actionable. For me, that's an important role, is that we understand and talk about what creates health. But based on that context, what role should the range of health sectors play and can play and have played in coalition, by example, in some of the benefits derived. I think that is an interesting thread, I think, that would be useful to consider.
Building in Martha is something that is important. So we keep inviting people to come to our table, and we need to figure out the way, how do we get invited, or just go and show up to the other tables.
Thank you. I have an observation that Evans and Stoddard, who I consider some of the giants of thinking, wrote that the ultimate test of health policy is whether or not it adds to the well-being of the populations served. And then I was, maybe the other table will respond to me, but I was rather sort of stunned when Bridget said, well, the criminal justice thing is individual. And because, yes, the intervention at the individual level, but well-being is at the community level, not having a bunch of guys running around. I mean, so that if your wife is into BMWs, she can actually drive to the grocery store without getting jacked, that kind of stuff. I mean, that where you really have community safety, or you can ride, I mean, as a bicyclist, I can ride my bicycle through a town and expect to ride out the other side rather than being carried out in a bag or something. And so I think it is a very population intervention, even though the intervention is, the intervention is at the individual level, but the effect is at the individual and the community or population level. So, thanks.
Dave Kindig, University of Wisconsin. I have three things. First, I really appreciate this day. I thought it was difficult, actually, to understand it all and to see what we were doing, but I think we've had one or two other activities in this vein, and I think it just underscores the wisdom of saying that this is going to be one of the priority areas that we're going to continue, to work on over the next couple of years. So it needs a lot more work like this, and we have people here that can do that. Second, I really appreciated when Bobby got up and did his little organizational slide, because it really helped to sort of, bring a lot of things together, and not a complete list of categories, but I think that we ought to make sure that gets some prominence. But at the same time, I was struck that the list felt sort of marginal to me in terms of what the challenge is, if you really look at the Betsy Bradley, if you accept that general analysis and so far we need to go. So to pick up sort of on what Martha said, or we talked at this table, I was thinking more about, and what was just said, where we really need to go to other people's tables and just support their efforts for additional resources in their fields, like education and economic development and whatever those are, and knowing that they'll have population health benefits, but that they don't have to be tied to that for our joining them in political advocacy, really.
Other roundtable members, comments, reflections?
Kathy Bazzi, and I had an interesting thought about how, from the macroeconomic construct that we've talked about, and how the shared funding for most of these things like education and health and things are out there. It was interesting to see today played out the shared benefit, the sort of co-benefit. And it reinforced this sort of connectedness from the macroeconomic perspective, but also from the system perspective of the creation of human flourishing. And I was thinking about the well-being for the nation sort of summary report that's coming out through the work of Samueli and some others, about how we're all really maybe more together than separate from a reality perspective on what we're trying to accomplish. And it has many names, it has many silos working on it, but it's all about getting to a successful and flourishing society. And that just brings us together in so many different ways. So getting our systems thinking through that full continuum was useful.
Bob Griss with the Institute of Social Medicine and Community Health. The 4 models that we focused on today are exceptions in those sectors. We may like to think that criminal justice is all going the way of this prevention model, or that energy, the fossil fuel industry has let go of energy. But I think we're fooling ourselves, just like we have a tendency to think that since public health is such a good thing, it has so many co-benefits. How could we possibly lose? But in fact, we're losing politically. And all of these sectors, these models that look so logical, they have had to fight political battles, just as we have to fight political battles. The political determinants of health are underlying the social determinants of health that we frequently look at as the shortcuts to getting the health population health improvement. So I think that we really, in beginning to look at these successful models, we need to recognize what the political constraints are and figure out how to address them. We sometimes talk about addressing them through democracy or community participation, but those are important principles that we have to translate into political strategies. And until we succeed in doing that, I think we have a good product, but it's more than a communication problem that we have. I think it's a political struggle problem, and that we have to frame it in ways that social movements can adopt it and lead it, and that we're not going to do it by just pointing out good analogies, although I was also impressed with many of them today. So thank you.
Bobby Milstein. I'll just offer one thing that we had talked about as a planning committee that didn't actually happen today, but I'm glad to see the conversation has gone in this direction, is what do we call the style of practice when you're not putting one topic always in the foreground and others are sort of a means to that end? Our colleagues at Climate Interactive call this multi-solving, that there is a practice, good solutions solve multiple problems, and what is the discipline of multi-solving? And you know, one of the messages from the February workshop from the Frameworks Institute that we had it was really one of the most striking things I've gotten from these roundtable meetings was Julie Sweetland, who said that Americans will strongly endorse solutions to problems that they refuse to believe even exist, because pragmatism is a powerful ethic, and it sort of surpasses many other elements of dogma and ideology. And so it could be that multi-solving is the sort of discipline of population health pragmatism at its best. And what we've seen here today, I think, are examples. They are exceptions to the norm, but you can't argue with success. I mean, they are indeed doing things that people heretofore had not believed were possible. And you know, when the judge says, I have $700,000 that I would not have had a few years ago had I not gone through this process, that's real. When there are billions of dollars recirculating through Medicaid waivers that hadn't happened before, it's a question of who's part of it and how are we dealing with that. And so I think we're talking about a sort of a new style of practice for multi-solving. And if we're serious about population health, then maybe we need to relax the name and get down to the practice of exactly what are the problems that can be solved together. And the hope is that those problems, when solved well, can actually be financed well. And I'm totally with Dave Kindig about this. We really should be talking about solutions at the full macroeconomy level and not be content with these small sort of boutique examples on the margins.
Well, I think with that note and noting the time, I like the multi-sector, multi-solving approach that we're kind of generating here. So I just want to thank all of you for being here today and building sustainable financing structures for population health. Oh.
Could I ask one question?
So, Bobby, just for the record, since we're at the end of this, and I love your point, multi-solving toward what end?
Plural ends. I mean, that's the whole point.
So is it okay, terrific. Thank you.
Yeah. It's a web. So just want to thank all of you for coming, and I want to remind you that the audience that the workshop video presentations and related materials will be available on the meeting page within a few days. And for those who are with us online still, you can access the meeting page from our webpage, which is nas.edu/pophealthrt. You can also send questions there if people have questions. I want to thank our planning committee who helped to make this day possible, the speakers. I want Chris, thank you so much for being our moderator and making it very engaging. Thank you. And of course, I want to thank I started to say IOM, but I caught myself, the National Academies of Sciences, Engineering, and Medicine staff, Lena Bachu, Darla Thompson, Colin Fink, and Amy Geller for helping make this possible, and of course, always for Rose Martinez's support and leadership. And so with that, any last comment before we adjourn the day? Chris?
Just wanted to say that the link is in the resource part, but I actually brought 20 copies of the booklets. I waited until the number got to about 20. So there's probably one here for everyone before you leave. Thank you.
All right. Thank you. We are adjourned. Thank you very much.